Good evening all. I'm Aditi Lamba with the Wednesday night edition of South Asian News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's begin the episode taking a look at the coronavirus pandemic and its impact. The world has surpassed 179 million cases of COVID-19 with now nearly 4 million deaths. Globally, only about 10% of the world's population is now fully vaccinated against COVID-19. India, home to many of our viewers, has now surpassed 30 million COVID-19 cases with at least 391,000 deaths. Earlier today, the Indian Union Health Ministry reported 40 cases of the new variant of concern in the country, the Delta Plus variant, and these cases have been detected in the states of Maharashtra, Kerala and Madhya Pradesh. Here in the United States, we are at more than 33 million cases of coronavirus with at least 602,000 deaths. Experts are saying that the Delta variant, which was first identified in India, is dangerous and more transmissible and could cause a full-on resurgence of the coronavirus in the United States. So, it is extremely important right now to get your COVID-19 vaccine. You can find more information on finding locations to get vaccinated on vaccines.gov. In politics today, President Biden announced his crime prevention plan following a nationwide surge in violent crimes. He signed executive actions focused on decreasing gun crimes and called on the Congress to work on gun control laws. With that, tonight's episode covers much on COVID-19 updates and measures along with the celebration of International Day of Yoga. Here are the headlines. COVID-19 vaccine safe for children and young adults, Dr. Anuj, Vohra, Connecticut. CDC says nearly every COVID-19 death is preventable with vaccines, Dr. Tushar, Patel, New Jersey. GOPIO and Happy Life Yoga host Virtual International Day of Yoga, Manhattan, New York. Time for a short break on Vision of Asia, Voice of the Community. We'll be right back. And welcome back. I am Aditi Lamba and this is Vision of Asia, Wednesday night episode of South Asian News. On the coronavirus pandemic and more, we have now our conversation with ITV Gold's health expert, Dr. Tushar Patel. At least 150 million Americans have been fully vaccinated against the coronavirus. That is more than 45% of the population. About 65% of the adult population is also now fully vaccinated. Even though this is good news, the spread of the Delta variant of the coronavirus in the country now poses a threat on low vaccinated states and anti-vaxxers. This Delta variant is more transmissible and dangerous and can cause very severe case of COVID-19 in unvaccinated individuals. On that, CDC Director Dr. Walensky has said that nearly every death, especially among adults due to COVID-19, is at this point entirely preventable, and that those still dying from COVID-19 are overwhelmingly unvaccinated. So again, make sure to get your COVID-19 vaccine if you haven't yet. Visit vaccines.gov for more information. Here's a conversation with Dr. Tushar Patel on this and much more. We're looking at about 45% of the country still not vaccinated with the first shot. There are states that have had very low vaccination rates. There is a Delta variant that's also spreading, concerning experts on a resurgence. So now what do we do? And also, how does that affect other states that have already achieved 70%, at least one dose of the vaccine?
So vaccination has to be throughout the country. Right now, we are at that stage, slowed considerably from, we had 3.3 million at peak in mid-April, now less than a million, close to 800,000 people in June, every week vaccination. So vaccination rates are highly uneven in the US, in the states, lower in many states in Midwest and Western states, and demographic groups also among young people. All those are biggest concern in the US. US. So I think we need to ensure that the vaccinations are equally distributed, equally received by the people in the US. And it definitely can impact because the travel restrictions are no longer in the US. So people from Western states can come to the Eastern states, and Eastern states go to the Southern states. And definitely that can spread into a newer pandemic in this country.
Doctor, why do you think young adults, people from the age of 18 to 27 are not getting the vaccine? I remember having a conversation with you a few months ago in which that age group was responsible for the surge we saw after spring break. So why are they not getting vaccinated?
Misinformation, lack of communication, consistent communication needs to come from all the way from the federal level to the state level to the county level, from the provider, from the pharmacy level. I think that is not happening. It has to happen. And if we don't get those individuals, I think we will definitely see a big surge in September, October coming.
Right. We're also getting the news that the country may fall short of President Biden's goal of vaccinating 70% of U.S. adults with at least one dose of the COVID-19 vaccine. What are your comments on it? And did we do a good job? Has the country done a good job in vaccinating?
So the good news is many states reached that 70% goal of at least one fully vaccinated individual. Only 16 states met that 70% goal. So it is a concern, and I think that concern needs to be addressed as quickly as possible, because right now we are in the golden period of taking the mitigating steps to increase the vaccination rates in the US between now and end of August, when the summer is over. I think by the time fall comes, September, October, and if we are not reached at that 65-70% rate, we definitely will have a huge problem in this country. And that is my prediction.
If the millions of people that are anti-vaxxers or choosing not to get the vaccine do not get the vaccine, can they affect vaccinated people eventually?
That is the concern right now. And I think that was one of the best questions so far, that we need to ensure that we need to protect those individuals who are not vaccinated. So if we cannot protect those young individuals, and a lot of people, young individuals, are in the hospital right now, and we need to ensure that those individuals are vaccinated, because they can get the infection from other people.
More on the coronavirus. The U.S. Food and Drug Administration today said that it will add a warning about rare cases of heart inflammation in adolescents and young adults for Pfizer and Moderna COVID-19 vaccines. CDC advisor groups found the risk is likely linked to the vaccines, but that the benefits of the shots appear to clearly outweigh the risk. The CDC also said that patients with heart inflammation generally have recovered from the symptoms and done well. The U.S. Department of Health and Human Services also joined these leading public health officials and have said that the vaccines are safe and effective, and that the heart side effect is extremely rare. All health experts are urging patients to get their children vaccinated who are between the ages of 12 and 17. But what is the importance of getting vaccines in children? And should schools in the fall require masks? On this and much more, we spoke with Dr. Anuj Vohra, the Emergency Department's Medical Director at Hartford Healthcare Medical Group. Here is Dr. Vohra. I'd like to now discuss children and vaccines. I have a couple of questions on that. Let's first look at the age group of 12 to 17 who have been approved to get vaccinated. The Pfizer vaccine is available for them. How are you looking at that age group and the importance of getting them vaccinated? And also, many parents are concerned about the effects of this vaccine on that age group. What do you have to say?
So the side effects we've seen in that age group are very similar to the side effects we've seen in the adult population. However, I want to start by saying those side effects are rare, extremely rare. We're talking about less than 1%, less than 1 in 100, likely less than 1 in 1,000 that will have a significant side effect. And we're seeing the same thing in that population. So it's still extremely safe, and it's strongly recommended that all children above the age of 12 get their vaccine performed. And over time, we're hoping that the vaccine will be approved for even younger children. And my children are super young. They're ages 3, they just had a birthday, 3, 5, 5, and 6. If the vaccine goes down to their level of age, I'll be happy to get them vaccinated. Because remember, COVID does not forget about the youth. The highest risk populations may be the elderly, but as we return to schools in September, August and September, our children are going to be at risk again. So I'd like to do everything possible to make sure that my children are safe once that vaccine is offered, and I'd recommend others do the same.
Right, and their age group, which is between 2 to 11, is already having clinical trials done by Pfizer and Moderna right now to figure out, how to give these vaccines. We're also hearing there may be a lower dose of the COVID vaccine, on these children. Your comments?
So we often see that in medicine. Weight-based dosing, for example. A patient comes into the emergency department and they're age 2. They're going to get a lower, and they need an antibiotic. They'll get a weight-based dose of an antibiotic that I would give an adult typically, because you give a smaller dose. It makes sense to do the same with the vaccine as long as the clinical trials prove that it's still efficacious.
Right. And now looking at this age group, especially, doctor, I have the million-dollar question as I've been asking. Schools reopening, which you just mentioned, is happening in the fall. We may not have results on the trials of 2 to 11 until late fall or late September, as they're saying. For children below the ages of 6 months to 2 years old, they're still doing clinical trials. They'll have results in October or November. So when you're looking at all of this and you're seeing kids go back to daycare, to kindergarten, to elementary school, to middle schools, what should they be doing? How should the protocol look like? Should we require everybody in that school to wear a mask to protect our children?
I think it depends on the level of numbers in your area and the amount that's vaccinated in your area. So, for example, if you live in an area that has a vaccination rate above 75, 80%, and a very low COVID rate, I think it would be safe to go without masks in that school district. But if you're in an area that has a low vaccination rate and a high prevalence rate of COVID, then you need to stay masked. So I think it's going to depend on geography, my personal opinion.
Right. Do you see a lot of kids going back in person in the fall? Would you recommend that to other parents, being a parent yourself?
I would. Being a parent myself, I plan to have my children in school. I just had my children in school. They've been in school for many months now. And they've had to wear masks, except for my 2-year-old, who now will need to wear a mask because he's 3. And it's been okay. They've had minimal scares at their school for COVID. I think maybe there were 2 cases, one inside one of my child's classrooms and one outside of it. But there was minimal disruption. And that was in my local place, my local school.
Wow, there's some good news coming.
What's that?
So there's some good news there.
Yeah. And I think if the numbers are low and the vaccination rates are high, I think we're going to be okay. And I think those are the areas that I definitely recommend putting the children back in school for. If you're living in a state or a county that has high numbers of COVID and low vaccination rates, I think they should consider staying at home until those numbers are fixed.
And more on vaccine, doctor, I just have a couple of questions left here for you. Today, CDC Director Dr. Rochelle Walensky said that those dying from COVID-19 are overwhelmingly unvaccinated. You work in the ER, you're the head of the department. What are you seeing? Is it true?
Oh, yeah. If you're not vaccinated, you are much more likely to get COVID. And should you contract COVID, it's going to hit you much harder. For those few patients that have been vaccinated and have gotten COVID, their symptoms we've seen in the emergency department have been much milder than those who were not vaccinated.
Well, it's time for another short break on Vision of Asia, Voice of the Community. Don't go anywhere. We'll be right back. And welcome back. I am Aditi Lama and this is Vision of Asia South Asian News segment. This month we are seeing several celebrations of the 7th International Day of Yoga, recognizing the many benefits of the ancient Indian practice of yoga. The day has been commemorated since 2014 when the United Nations proclaimed June 21st as the day to honor India's gift of yoga to the world. This year, the theme was Yoga for Well-Being to address the psychological and physical effects of COVID-19 pandemic on the world and to utilize the practice of yoga for better mental health and well-being. On this recently, the Global Organization of People of Indian Origin, GOPIO Manhattan, in collaboration with Happy Life Yoga, held a virtual yoga event to raise awareness and also funds for the COVID-19 relief in India. The event saw demonstrations from Emmy-nominated filmmaker and Happy Life Yoga speaker, Mr. Turlok Malik. The event also saw Indian Consul General to New York, Mr. Randir Jaiswal, address all on the occasion of the International Day of Yoga. Here is the story.
Ambassador Randir Jaiswal ji with us today. Sir, I am very, very grateful to you for giving me your blessings, and to all of us. After we listen to you, I will ask a question from you. So please, sir, first we will take your blessings. Sir.
There are three important elements why yoga appeals so deeply to me, and they are: one, of course, yoga is about unity and togetherness. What better value can we celebrate than this? Second, yoga is about living in harmony with nature and living in harmony with yourself. And most importantly, yoga enables you as an individual to experience, have the deepest experience of your existence as a human being. These are some of the values that we must celebrate today, tomorrow, and always. Happy International Day of Yoga to all of you. Thank you very much.
Why, as a human being, we don't follow? We know I should be healthy. I know we should do this. Why we don't do that, and how to motivate ourselves? Please share your ideas in brief.
There are two apps the human body always had from day one, and it comes as naturally as the breath. App number one, meditation. App number two, yoga. You actually don't need anybody else to teach you these apps. We have these apps, they stay with us, and when we go to another incarnation, they travel again into that incarnation. These are apps we were born with. The issues that we deal with while walking on planet Earth have been there eternally. We get stuck in traffic jams today. We have to pay taxes, look after our spouses, get our kids into college. Hundreds of years ago, there were other issues, similar issues. And thousands of years ago, they developed a reasoning, a very scientific and an artistic way to use these apps to solve those issues, to make it more easy for us to deal with difficult situations.
Yeah, doctors, science have made so much progress. You will be fine. But the person who's going through with that inside, they know what it means. They basically want to say, you don't understand. You do not understand what I feel. Sangeeta ji, I want us to enlighten us. If someone we love, or unfortunately the person themselves, if they are in that state of mind, since you work with so many cancer patients, which is a fatal disease, what will be your mantra, how to deal with that?
I think as many of our esteemed speakers have said before about going inward. So what I would like to share with you is a four-step framework. So 4 points that will help you. So first is, you go inward and you prepare yourself, because just imagine, all of us have things where something breaks in the house, right? Your toilet broke, and yes, it's a nuisance, but then you come up with a plan on how you're going to fix that, how you're going to address it, and then you feel okay. So stress unmanaged is cause for suffering, but stress managed is grounding. So first is to make that plan for yourself. Go inward, find what you need to do here, and then make that plan. Now, second step is, how do you make that plan? You need people, you need your tribe, because you're going into a new situation that you are not prepared for. You may not have known what to do here. So find your tribe, find experts who know about this, find other patients who know about this, find a community, find ways that you can educate your friends and family. So the second is to find your experts. Third is to find something positive to look forward to, whether that is something positive to look forward to every day, like Tilak ji, you talk about it, or to find something to look forward to in near future. When this is done, I'm going to go on this vacation. When this is done, I'm going to do this. So then you have something positive you're working towards. And fourth is to promise yourself that you're going to go inward, listen to your heart, whether that is crying today for help or whether that is finding peace. Listen to your heart, go in, and you will find that peace and grounding in you. It's the yoga of life. It's the yoga of mind that can help you by going in, go out.
How do you bring your partner, your husband, wife, or girlfriend or a boyfriend on the same page so you could walk towards the health? Because many times I see husband wants something else, wife wants something else, and how do you bring that on a same page? Since both of you are working in the holistic health business. Over to you, Andrea Neil.
Go ahead.
Okay, well, I would say that the power is in the hands of the person doing the cooking. So that's a big help. But really, it's the lines of communication, keeping that open, respecting each other, and supporting each other on this journey that we've chosen to share together. That is important. We've chosen a vegan lifestyle. It's interesting that we came on right after Anil Narang, if I'm saying that correctly. So
timing.
Neil's been vegan for
Over 35 years.
Over 35 years, yeah. And I'm close to that long.
But how do you deal with that? Like, sometime I'll see outside my restaurant, wife will say, let's eat here at the Ayurveda cafe. The wife will say, let's eat here. It's healthy food. Husband says, no, I'm in the mood of steak. Does that ever happen? How do you
Yes.
put the wife on the same page?
For sure.
Without fighting?
Fortunately for us, we were both vegetarian, vegan before we even met. We were already on the path separately. As a matter of fact, our relationship started. We met in a health food store. And from there, we started exchanging books, both on health, vegetarianism, and spirituality.
The other day, I think I wanted to eat in the Indian restaurant, and Neil wanted to eat. Where did you want to eat? In Mexican or something?
Mexican, yes.
We have now a short announcement. Join St. Jude Children's Research Hospital this week for fun content and activities themed around the movie Raya and the Last Dragon, including a special reading of the story by the voice of Raya, Kelly Mary Tran. You can also take part in the live art session with St. Jude survivor Tate on Thursday, June 24th at 12 p.m. Pacific time. Just RSVP by going to facebook.com/itv.gold and then clicking on the link in the pinned post. Raya and the Last Dragon is an epic journey to the fantasy of world of Kumandra, where Raya learns that it takes more than a dragon to save the world. It takes trust and teamwork, timeless themes reflected in pioneering research and life-saving treatment delivered at St. Jude's Research Hospital for kids with childhood cancer and other life-threatening diseases. Because of generous donors, families never receive a bill from St. Jude for treatment, travel, housing, or food, because all a family should worry about is helping their child live. St. Jude also freely shares the discoveries it makes, so every child saved at St. Jude means doctors and scientists worldwide can use that knowledge to save thousands more children. Well, this wraps up our show for the night. Please send us your suggestions and get your voices and organization on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. Remember, you can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Diti Lamba. Take care and be well.